ஜெயந்தி, நான் எல்லாரையும் அட்மிட் பண்றேன்.
ஓகே சார்.
குட் மார்னிங் மேம்.
Good morning, everybody.
குட் மார்னிங்
Can you-
டாக்டர் ராணா.
Good morning, Dr. Kaur. Good morning,
Hi,
Sharan.
Dr. Rana. How are you?
I am fine,
Morning.
madam. Yes, good
Good
morning.
morning, madam.
Good morning. Good morning, everybody.
எனக்கும் எந்த சம்மந்தமும் இல்லை சார்.
சார் வணக்கம்.
வணக்கம். குட் மார்னிங் அண்ணாதுரை.
குட் மார்னிங். Cyril sir, can we wait for 2 more minutes? People are joining.
Good morning to all. Prajna is our student leader, the CAT leader, Children Against Tobacco leader. So I'm requesting Prajna to start the.
Good morning, everyone. My name is Prajna Arun, and I am the spokesperson for CAT. Thank you so much for this opportunity. So, I would like to start off the occasion by introducing CAT. CAT stands for Children Against Tobacco, and CAT is an organization under the Marianne Charity Trust based in Tamil Nadu. We serve as the platform for young minds to voice their concerns, share knowledge, and inspire collective action against tobacco. Today is a momentous occasion, and I am proud to receive the opportunity to be hosting it. So, without further ado, I would like to invite Cyril Uncle to start off the event.
நிறைய orders. Late night I don't.
Thank you, Prajna. Today is a very important day. Thanks for joining, everyone, especially our chief guest, Dr. Jagdish Kaur. She accepted the invitation a very short time, and then we are very happy. And then Dr. Rana Singh, always in tobacco control, always supporting the MAC initiatives, and then all the partner organizations throughout India. Every year we are conducting these online competitions. This is the 5th year. So last year around 4,500 participants have been participated in this World No Tobacco Day activities, and then around 12 states they participated. So this year the theme is protecting children from tobacco industry interferences. It's a very important topic because children are our main focus, and then really we have to work with children, and then children has the potential capacity to change the entire thing. So the tobacco control, really we have to invite children, and then definitely they have the role to play. And then we have to, as an adult and tobacco control community, really we have to protect the children because we know the tobacco industry is playing a many roles in the community. So they are also going to the schools, they are also in the different places also. They want to capture the children in very young age. So really we have to address this issue. So this year the topic is really, it's very interesting one, and then definitely we will reach out to many children, and then this is a good opportunity for us to reach to children, especially in the school age children, and then through these activities. So I think we have more than 10 competitions. Jayanti will be explaining about the competitions in later stage. So this year we want to reach to different states also. So really we are now keen to move to different states, and then requesting all the state partners to participate in this World No Tobacco Day. I think this is one of the biggest civil society initiative in India. The sustainability also is there. So thank you very much for joining with this. The World No Tobacco Day, we have time. It's more than a month, but still we want to start very early, because this 1 month, this competition will go up to May 20th. So this 1 month we will do a lot of campaign activities. We want to reach to masses. We want to reach to different sectors also, not only the health sector. Really we want to reach to the education. We want to reach to the environmental groups. We want to reach to the child rights groups. So we want to reach to the different sectors also. So that's why we are having this 1 month competitions. It's an online competition. So thank you for joining. You are all, I'm welcoming everyone too. this launch program. Thank you.
Thank you, Uncle, for your wonderful welcome address. It is definitely inspiring to see how tobacco control has progressed so far. Now it is my greatest pleasure to welcome Dr. Jagdish Kaur, our chief guest for the day. She is a regional advisor for the Tobacco Free Initiative under World Health Organization. As a medical doctor and a public health expert with extensive and progressive work experience, she is really a wonderful person to have us start off this program. And her efforts have resulted in decline in tobacco use prevalence over the years, and she's also trained in global tobacco control at the Johns Hopkins Bloomberg School of Public Health. As a medical doctor with an MD in pulmonary medicine, she has specialized training in managing chest diseases and promoting lung health. She has over 25 plus years of experience in public health, and now I would like to call upon Dr. Jagdish Kaur to start off our ceremony.
Good morning, namaste, vanakkam, and many thanks for this kind introduction. I'm happy that this interactive and participatory event is being organized to sensitize the youth about this important global issue. I take this opportunity to congratulate the organizers and other partners who worked hard to make this event happen, and now for the fifth time. With this small introduction, I'm now launching World No Tobacco Day 24, 5th National Online Contest today. Over.
Thank you so much for launching the program, ma'am. Going to Prajna.
Thank you so much, ma'am, for launching this program. It has been an honor to have you here. Next up, I'm really excited to invite Dr. Rana J. Singh, Director Tobacco Control, Southeast Asia, Vital Strategies, for delivering the keynote address. He has led the tobacco control program in India for more than a decade, establishing politico-administrative support, building infrastructure and capacity, forming coalitions, enforcing legislations, disseminating public information, and monitoring and evaluating progress. Although India has already had a national tobacco control law, there have been many challenges. Over the past year, Singh and his team have supported this national tobacco control cell and helped establish equivalent cells within the country's 29 state level governments and 350 districts. It is my greatest pleasure to now welcome Dr. Rana J. Singh for the keynote address.
Thank you, Prajna. Before Dr. Rana speaks, and then I'm requesting Dr. Jagdish Kaur to give her speech, and then we can move to that.
Should I proceed, Cyril?
Yes, ma'am. Yes.
Okay. Thank you so much. Thank you so much for accommodating the request. Friends, ladies and gentlemen, the member states of World Health Organization designated 31st May as World No Tobacco Day in 1987. This was done to draw attention to the global tobacco epidemic and the preventable deaths and disease caused by tobacco. Since then, WHO and partners have been celebrating this day globally every day on 31st of May, highlighting various aspects of tobacco control. In 2004, the world moved forward in its fight against tobacco, and the WHO Framework Convention on Tobacco Control, FCTC, came into being. This is the only treaty WHO has come up with in its more than 75 years of existence. So you can just imagine the importance of the treaty. Every year, the World No Tobacco Day reminds us of the dangers of tobacco and informs people around the world about what they can do to claim their right to health and how to protect future generations from harmful effects of tobacco and nicotine products. The World No Tobacco Day also gives an opportunity to expose the business practices of tobacco industry. This year, the World No Tobacco Day calls on us to protect our children from the interference of the tobacco industry. It is imperative to understand how the industry reaps all the benefits at the cost of human health, human lives, national economies, and the environment. All over the world, the youth are calling on governments to adopt policies to protect them from the manipulative practices of tobacco and related industries. This includes the relentless marketing of their dangerous products through social media and streaming platforms. The fight against tobacco is particularly important for us in the WHO Southeast Asia region. Out of the 1.2 billion global adult tobacco users, 411 million, that is 33%, tobacco users reside in this region. Over 280 million adults, that is 77% of the global total, they use smokeless tobacco in the region. Additionally, 11 million adolescent tobacco users, that is one third, 30% of the global total, are residing in the region. So, this makes the region the highest tobacco use prevalence in entire world. The numbers are not just statistics, they point towards all the struggles in our everyday lives with real impacts and happenings. The susceptibility of youth to tobacco and nicotine products is very, very alarming. Despite laws, accessibility remains a concern. It is time to take action and protect our children from the harms of tobacco and nicotine products. The industry is constantly pushing new and emerging tobacco and nicotine products in the market. All countries are vulnerable to these products. It's not that, only the low and middle income countries, even the high income countries in Euro and Americas, they are struggling with the products. A large proportion of youth in Thailand and Maldives, they are using electronic cigarettes. Although the law in India provides for a blanket ban on electronic nicotines and related products, these can still be accessed through various means. The tobacco industry indulges in unethical practices, including promoting sales near schools and using different forms of traditional and digital media to aggressively advertise and promote their products to children and adolescents. The multi billion dollar industry recruits new users to reward their investors with even more profits. To achieve this, it preys on children and young people through marketing tactics, targeting them with new tactics every day. The tobacco industry moves with speed to launch their products, using all means to expand market share before regulations can even catch up with these tactics. The highly addictive nature of nicotine, coupled with false claims about reduced harm by the industry, perpetuates addiction and necessitates immediate action. The youth are being exposed to a lot of smoking scenes in the films and serials shown on various OTT platforms and social media. Unfortunately, despite the law, the same continues unbated. The film industry is hand in gloves with the tobacco industry. India has comprehensive law for tobacco control, and the country is also party to WHO FCTC and the protocol to eliminate illicit tobacco trade. The country has guidelines for tobacco free educational institutes. This is high time that we don't become complacent in view of the ban on electronic cigarettes. There is urgent need to strictly enforce the ban to save our youth. The civil society and all partners have a key role to play here. The facts must be told in a loud and clear manner. There is no room for any complacency any longer. It is time to act. Please use WHO World No Tobacco Day campaign material widely. This can be further translated in different languages for maximum outreach. The social media platforms can also be used to reach out to the youth. This will be available on the WHO website very soon, and that is for the videos, the posters, the social media slides, and everything is available. So please use that. The industry must be given a very clear message: stop the lies. Please keep the momentum on. Don't make it a one time event, because mostly the schools are closed during the summer season, and that especially on 31st of May. The campaign must go on. The Global Tobacco Regulators Forum is meeting next week in Netherlands. Government of India is participating with the high level delegation led by Secretary Health himself. The high level group will deliberate on the current challenges and updated evidence on the regulatory practices, especially looking at electronic cigarettes and new and emerging products. I will rest my voice here. Thank you very much for your kind attention. I would have loved to stay back, but I'm sorry that I have to leave early because I have to proceed on duty travel soon. Have a very nice day, and once again, thanks for accommodating my request. Thank you so much.
Thank you, Dr. Jagdish. I apologize for the mix-up, but it was a really enlightening talk. I especially loved hearing about continuing the initiative, because I definitely feel like schools are more excited during the first part when you introduce them, but it's really important to keep the momentum up, and people like you inspire us to do so. So thank you so much. Next, I would like to invite Dr. Rana J. Singh, Director India, Vital Strategies, for the keynote address.
So thank you, Ms. Prinja, CAT leader. Respected Dr. Jagdish Kaurji, Regional Advisor, Tobacco Free Initiative from WHO CRO, Mr. Cyril, and whole team of MECT, all the dignitaries. I see many experts, many colleagues who are working in tobacco control for the last almost more than 1.5 decade, who are present in today's launch event. So good morning, all of you. First of all, definitely it is congratulations on to MECT and CAT team on organizing of this 5th online context. I have been part of many activities of CAT in the past also, and also this online contest. And I believe children and youth participants are very crucial. Their participation in this kind of event is really something which is very much required. You see, there is high tobacco use prevalence among children and youth. If we see the GATS Global Adult Tobacco Survey 2 data, we find that almost 54% of users, they have already started tobacco before they are 19 years of age. There are people who start before 15 years, then between 15 to 17 years of age, then between 17 to and 19 years of age. And 54%, they have already started tobacco use before they are 19 years of age. And roughly 64% or 65% before they are 25 years of age. So this is an age group which is really very important, where we need to focus. This is our age group when people start to use tobacco. So I think this kind of activities, I know the contribution of CAT and many other partners who are focusing on children and youth related work. So I think this is really very important to educate them, to children and youth. And we also need to design our programs, our mass media campaigns, our IC campaigns in such a way that they really tackle that population. So the focus on them is really something which is very crucial. At the same time, Dr. Kaur has already explained us about how tobacco industry plays various tactics. They design various kinds of new products. They advertise them. They develop many strategies to advertise their products. So tobacco advertisement, promotion, and sponsorship is a big tool with the tobacco industry, which entice children. And I would like to share with you, even during COVID-19, when all of us, the health professional, whole of the governments, they were fighting with the COVID-19 epidemic, tobacco industry, they were designing and developing and doing the programs to entice children and youth, even during that time. So we need to be very, very vigilant from tobacco industry tactics. This year's theme, also World No Tobacco Day theme, is also focus on protecting children from tobacco industry interferences and industry tactics. So I think this launch of online contest is very, very timely. I expect, as Mr. Cyril said, that they are going to approach to the states also, to their state partners. So I expect that it is really going to be a very wonderful and very big event. And we will ensure that we have big participation from different states, from different languages from throughout the country. So once again, thank you, Mr. Cyril, and congratulations to whole MECT team and CAT leadership. Thank you very much. Over to you.
Thank you, Dr. Rana, for your valuable insights. We are definitely excited to see the social impact of this program. Next up, I would like to call upon Ms. Jayanti, Project Manager of CAT, for briefing the contest.
Thank you, Prajna. Good morning, everybody. So I'm just going to share you a presentation of posters for each individual contest. Excuse me. So this year theme is protecting children from tobacco industry's interference. So this is a theme we are going to continue for all our competition. We have 10 different competition, and we have 2 categories of age group can participate. That is category 1, 8 years to 18 years children can participate, and category 2 is above 18 years to there is no age limit for that. So these are the 2 categories we have, and the prizes and the juries and judges will also goes with these 2 different categories, and they will be selecting the people. And the portal is on today, and from today we have a portal, tobacco app, monitor app, which is there in the Google Play. 1 minute. So how do you join in this? Can you able to see my screen? Sir, can you able to see my screen?
Yes, we can see your screen.
Okay, thank you. So this is how you join the program, the contest is by downloading Tobacco Monitor app through Google Play. So you download through Google Play, and then you install the app, and then you register. There will be a button called, an icon called World's No Tobacco Day in that app. So you go into it, you register yourself with a phone number and a mail ID, and it will be automatically listed to according to your age as a category 1 or 2. Then you will be opening tobaccomonitor.co.in home contest submission page. So that has also been given in tobaccomonitor.co.in website. You can go there and you can check how you can open that portal. in that portal, you have to submit your competitions. So there will be 10 number of competitions which you can enter. From 20th April to 20th May, the portal is open with this theme, protecting children against tobacco industry's interference. You can enter into all the competitions like drawing contest, pencil sketching, reels making, photography, poster design, slogan writing, meme creation, song competition, short films, short story writing competition. These are the 10 competitions we have. And poster design, slogan writing, meme creation, song competition, short film making, and story competition. Last 5 competitions can be in bilingual, like in Tamil and in English. You can post any one of it. And one rule is that for reels making contest, below 18 years are not cannot participate in it. Above 18 years can participate in the reel making. And we have 3 songs for it, and the links have been given there. And you can participate in any 3. You can make it in a YouTube shorts. So I'm entering into each poster now. So this is a drawing competition. So this drawing contest contains the participants can use any medium of paper and colors, and computer drawings and paintings and all not accepted. Once you have done your drawing, you have to take a picture of it, a quality picture of it, and upload it in this portal. So for this, there is no age group. Both the categories can join. And pencil shading competition. Participant can use any medium of paper and pencil for this. The same procedure, you have to take a picture of it and send it, you have to submit it via the portal. And one participant can join in all the contests actually. So, but one entry in each contest is like, if you are putting it in a drawing contest, only one drawing you can put, but you can join in all the contests. All the 10 contests you can participate. So in reels making, there is a YouTube link. So you have to go to YouTube and create a YouTube short and upload it. This is what you have to do for reels making. For this, 18 years below are not allowed. Above 18 years can participate. Then we have photography contest. So they can submit their high quality picture for us to refer. And the submission starts from 20th and it will be 20th of April and it will be closed by 20th of May. Poster design contest, participants are allowed to make use of any computer software for designing and you can submit it to us. And the submission file should be in JPEG, high quality. Slogan writing, each participant can submit one slogan in a single sheet of paper and upload it. And you can do it in English and Tamil. Meme creation. One meme should be submitted by each participant, which should be strictly based on the individual's creations. You cannot put somebody's meme here. You have to bring your own creation and you can upload it in the portal. One person, one meme can go, and this also can be in English or Tamil. Song competition. So you can send an audio or a video song with a high quality with the same theme, protecting children from tobacco industry's interference. Short film competition. And this 3 minutes video should be sent. A short film which has 3 minutes and it has to be uploaded with a high quality. And the submission dates are 20th of April to 20th of May. Both the languages can apply. Short story writing competition. This should be typed and shared in a PDF form. So you have to type it and share it. Don't write and send it so that the handwriting issues won't, all those things won't happen. And it shouldn't exceed more than 1 page. That is A4 sheet, 1 page it should be, not more than a 1 sheet. So I'm again saying the final rules. What we do is like the portal is open from 20th April and it will be closed May 20th. Your submission has to happen by then. Download the Tobacco Monitor app. Register yourself in Tobacco World's No Tobacco Day with a phone number and a mail ID. With the same phone number and mail ID, go to the portal which has been given, which is there in tobaccomonitor.co.in website. You can refer the website for more details. Once the portal is closed, we will be announcing the winners. The prize distribution on 31st of May, that is World's No Tobacco Day. So that day we will be announcing. You can download the certificates through the portal which you have been uploading the contest programs creatives. And then the winners will be receiving the prizes over courier. And anything, we will be creating a group and we will be sharing all the details for those who have registered with us with the phone number and the mail ID. Thank you so much for listening and owing it to Prajna. Thank you, Prajna.
Thank you so much, Ms. Jayanti, for briefing us about the contest. If anyone has any questions, kindly put it down in the chat box or you can raise your hand. Now I would like to invite Cyril Uncle to discuss the strategies for our action plan with our partner organization.
Thank you, Prajna. Yes, as usual, every year we are reaching into many people, and then it's because of our partners. So the partners are reaching into different levels. Especially, I'm inviting Dr. Nisa Singh from Chandigarh, because we used to get many participants from Chandigarh. It's all because of Dr. Nisa Singh. She's from the Central Library. I'm requesting Dr. Nisa Singh to say some word and then what's your plan for this year?
Thank you, Dr. Cyril. It's indeed a great pleasure and a matter of great pride for us that we are participating and we are partnering along with you for such a noble cause. As we all know, it's such a problematic thing in India, especially I can say Northern India. So I really want to focus more this time. We've been partnering with you since its inception and it's the 5th year. And indeed, it's a great achievement, I think, for you, because Tobacco Monitor and MACT have been doing excellent work. And we would want to reach out to more schools this time. Earlier, more of private school children were participating, but now this time we will focus more on the government school children, because they need to be sensitized more, because mostly their parents are not that educated and we have to have this responsibility on our shoulders. So hopefully this time there's going to be participation many folds. Thank you so much.
Thank you, ma'am. Thank you very much. And then and now I'm invite Dr. Arun. He's one of the champion in tobacco control. So he's involved in different levels and then he's into different fields also. So I'm inviting Dr. Arun, and then he's taking the responsibility of Trichy and 3 more districts in Tamil Nadu. Yes, Dr. Arun.
So, Cyril, you are able to hear me?
Yes, sir, I can hear you, sir.
Yes. Okay. First of all, congratulations. Like, I've been following Cyril and MACT and CAT for years, like from Cancer Institute time for the past 15 years. Great work. I think keep continuing. I think this year we will reach new heights in creating this awareness. The May 31st is a very key day. The problem is most of the schools are closed. So despite that particular bottleneck, I think we should be able to reach out to every kid, every school kid regarding the awareness regarding the tobacco. So I wish luck for all MACT and CAT members and good wishes. And I think this time we'll be able to reach more and more people and create awareness on this particular issue. Thank you. Thank you very
much. Thank you, Doctor. Thank you very much. Now I can invite Dr. Rakesh Gupta from Chandigarh, from Shipper organization. He's here.
Yeah, Cyril.
Yes,
so
Doctor.
Thanks for calling me. Yeah. So I won't be able to open my video, but I must congratulate you and your team for wonderful work they are undertaking. So it is really required that kids should know about the tobacco industry interference and they should shun this addiction. Thanks a lot, Cyril. Thank you.
Thank you, Doctor. We will keep in touch with you, and then we will do the work in Chandigarh. Thank you. Now I invite that Mr. Annadurai from Vaigai Trust, Dindigul, is a social activist. So I'm inviting Mr. Annadurai.
Thank you, Sri. I really appreciate this initiative. Is very nice. Very good awareness on the overall in India. In Tamil Nadu is minimized. We need more different strategy this year. Especially school is the best initiative that most about children. We will plan to participate this year. Do you know very well this in holiday on the election is one of the big difficulties. Again, we discussed with our colleague already. Our tobacco network colleague is more involved in the entire process. I, in my organization, surely support collaborate with tobacco network. Here we will propaganda and awareness on the children's more. Many of the children as village-based children to be involved in the entire process. Here, assure the in my Dindigul and Theni and Madurai district. Thank you for the opportunity, sir. Thank you.
Thank you, Annadurai. Now I'm inviting Dr. Virgil D. Sami, one of the well-known child rights activists in Tamil Nadu. She's always worked with children, especially in North Chennai and all over Tamil Nadu. So I'm inviting Dr. Virgil D. Sami. Ma'am, are you there? Okay.
Can you hear me?
Yes, ma'am. Yes, ma'am.
Yeah.
We can hear you.
Yeah. Good morning to everyone. Congratulations to MACT and CAT and the whole team for your sustained effort in the fight against the tobacco and tobacco industry. And Arunodaya has been a part of this action and campaign for many years. And children from our children network, that is the Confederation of Arunodaya Children Sangam, have been participating in all these activities. And last year also many children from our Sangam took part in the competition, and taking part in the competition really brings about a lot of awareness, because they try to get information and they speak to different people and get their opinion, not to prepare their entries, be it song or the painting or drawing. They were collecting information which really kind of provide space for discussion on this issue with the different stakeholders like parents, community leaders, the youth group, and children. So this kind of an online competition I find is a very good initiative to kind of trigger discussion and also bring about awareness. So we are very happy to participate in this competition this year also. Some of our Children's Sangha members and the youth members also have joined in today's meeting. I'm sure they very much look forward to participating in the event, because last year one of our participants from our Children's Sangam also won in the competition. That gives a lot of kind of push and energy to this youth to speak on this issue. So we'll surely participate in this event. And schools, it will be a bit difficult. All of you have been saying because of the holiday season. But what I think is that whether we could reach through the children institutions, the child care institutions, their children will be there. Some of them might go for holidays, but some children will be there. So through the department, if we can spread the message and involve the participation of these children also, it will be good. And I'm also thinking about the, I don't know how far that will be possible, the correctional homes also. Because these children are the ones who get into this habit. So if we can have this competition extended and allow this, provide space for these children also to participate, it will create some kind of awareness and change in them. And Arunodaya, we are part of the Forum for Child Participation, the Federation of Children Movement for Right to Participation. Surely I'll speak to the members in that forum also, and see members, the children from that forum also can participate in this event. So we assure the campaign of the support from Arunodaya, because we believe in this campaign. We see children being led astray, losing their life. When I say losing their life, it's not the life as such, but their whole lifestyle, their future is spoiled. So this kind of campaign, we are happy to be part of it, and we wish success to the team. Thank you very much for this opportunity.
Thank you, ma'am. Thank you very much. Now I invite Mr. Devanayan from Tholamai. If Devanayan is not there, maybe Auxilia.
Good morning.
Sir. Yes, sir.
Good morning to all. My sincere appreciation and wishes to the MACT and CAT team. Really inspired your sustainable efforts to eradicate the tobacco in the country. We assure our collaboration with you. It's a very happy to collaborate with your all efforts. It's a great privilege to us to do this kind of initiatives. It is a very important need of the hour to promote drug-free or substance-free, tobacco-free culture in the community. That's why we are going to target our young audiences, young minds, to seed tobacco-free culture in this mind. It's a work. It will give more sustainable things to the young minds. Our as regular, our support to all initiatives, to all the CAT initiatives. Particularly this, we are working with more than 25 or 26 schools. We are going to communicate our school administration. They are having WhatsApp groups of the parents. We are going to share their our initiatives to the all parents, and then through the parents we got to initiate with the students to encourage to participate in this event. And then we are having 2 larger level communities. They have been more than 35,000 families are there in our community. We are going to we have field team. In this call also, we are having our community team members and then our senior staff member. They are going to coordinate with our community team members to encourage our children to participate more. Last year also they participated in this event. Third thing are our Ptolemy. We are closely associated with the media and social media team. We are going to encourage our social media team and then to promote the initiatives to more successful. Thank you so much for being Ptolemy as associated with the CAT programs. Thanks, Cyril and team. Thank you. Wish you all the best for the events.
Thank you, sir. Thank you very much for your continuous support. We will work together. Definitely, we will do some changes in the community. Now I invite Dr. Surender from Cancer Institute. I don't think he's in the list. Someone from Cancer Institute, please join. Anyone from Cancer Institute? Or I invite Dr. Murugesan from VCWS. Mr. Murugesan. Is not there?
Sir, வணக்கம் கேக்குங்களா?
Yeah, yes, sir. Thank you for joining, sir. Yes, sir. You want to say some words? I think there is a network problem. Mr. Murugesan is from Pudukkottai, VCWS. He is the convener of Tamil Nadu People's Forum for Tobacco Control for Pudukkottai district. We will come back and then we will work in Pudukkottai also, sir. Thank you, sir. Thank you very much. Anyone from IDA, Indian Dental Association? Or any other partners? And then now the floor is open to the general participants, and then if anyone want to give suggestion or anyone want to give some plan or something like that, it's open to all now.
Cheryl, there is a hand raised by Shyamala.
Shyamala, yes. Shyamala Nambi Nair. Yes, Shyamala. Shyamala, you want to say something? Yes, Jaswinder Singh.
Good morning, sir. I am Dr. Jaswinder Singh. I work in Tobacco Cessation Center. I am a nodal officer over here in the Government Medical College and Hospital, Amritsar. I am assistant professor over here. Can the interns and all the students of the dental college can get engaged in this competition?
Sorry, doctor?
How can the students in this dental college can get participate in this competition?
Yes, doctor. There is a link in Tobacco Monitor. They have to download the Tobacco Monitor application from the Play Store. From the Tobacco Monitor, you will find World No Tobacco Day icon. So they can click the World No Tobacco Day icon, they can register it, and then they will get the communication, sir. So we will share the brochure also with you. With Jayanti also, she will share it with you, sir. You can just give your email ID. We will send you all the posters and other things to your email ID, and then you can paste it in the college, and then they can participate, sir. We will keep in touch with you, and then we will provide all the details. Thank you for joining, sir.
Everyone has to download app individually.
Yeah, through that application, we have to participate in this competition, sir. Tobacco Monitor application is the national level one where they can give some complaints or something like that also. It's a purely for tobacco control activities. If you are able to download that application, through that application, your student will learn about the tobacco control section 4, 5, 6, and all the tobacco control activities, sir.
Thank you, sir.
I think in the chat we have someone named Dr. Jain who wanted to share their opinion on this. Dr. Jain, you are free to talk.
Dr. Aruna also wanted to say something.
Yes, sir. I'm Dr. Aruna, dental public health professional and a tobacco cessation specialist from Bengaluru. Sir, actually, through the Tobacco Monitor app, like as you said, like now the schools, like we have the vacations. So I thought of involving, we have our school alumni group, our own school alumni group, and we have upcoming alumni session also. So I thought of sharing this to my schoolmates and like just to assess the like compliance to this quota laws. So like each one of them, whether be it that many of them are teachers also and other stakeholders also. So they can assess even from their own children and as well as like the school nearby also.
Yes, ma'am, that's a good idea, ma'am. And then we have a two category. One is for children as well as for adult also. So above 18 also they can participate. Yes, the schools are closed, but nowadays, rightly you said, the WhatsApp groups are there. A lot of WhatsApp groups are there. So
Yeah.
we have to reach through them, and then definitely we can catch the children. Thank you, ma'am. Thank you very much.
And I thought of involving even the like elderly women also. So like even they are the vulnerable group, like exposure to the children and the elderly group who are exposed to the second hand smoke and the third hand smoke exposure. So I would like to utilize this platform to sensitize them also related to that, how they can protect themselves as well as the children also.
Yes, ma'am. Definitely. Those who want the brochures and posters through email, you can please
Yes, ma'am.
share your email IDs, and then we can share it with you, and then we'll keep in touch with you also.
Because
Thank
anyhow,
you,
the
ma'am.
schools are going to start after June 1st only. So the
Yeah.
only platform to involve is this thing. So they
Yeah.
themselves can assess the compliance, like where they stand and what they like know about it also.
Yes, ma'am.
Cyril, Dr. PC Jain wants to speak, I think.
Yes, doctor.
Dr. PC Jain?
Yes, Dr. PC Jain.
Dr. PC Jain, unmute yourself. Unmute. Yes.
Now,
yes.
can you hear me?
Yes, sir. Yes. Yes, we can hear you, sir.
Yeah, I'm from Udaipur and I'm 76 by age and practicing general practice along with the de-addiction of tobacco and all addictive substances. My experiences is that almost every month I am going to some of these schools and I enroll children by play. There are a lot of the play like मैं नशेड़ी से शादी नहीं करूंगी. I think you can understand what I say in Hindi. मैं नशेड़ी से शादी नहीं करूंगी. I think Pranna will also not marry a person who is tobacco eater. Would you, Pranna? Would you like to
Yes.
marry a person?
No,
Yeah.
no.
No. So this is a beautiful play we have prepared, and all the students, many of the students participate with this. Along with there are certain poems also. They are in Hindi, so they sing with me, and then I give the presentation also. What I will say, I'm surprised that I had been to a remote school from my place. Udaipur is a I think you all heard about the marriages. Big marriages are conducted in Udaipur. This is a city of jails. So major marriages are there. So from 72 miles away from this place, a remote village, I had been there, and the children prepared the food for us. And after that, I took my laptop also because I carry my laptops in the remote area because there is no other means to show the children. So you'll be surprised what I want to share. That myself and my wife asked, how many of you are addicted to tobacco and alcohol? I was shocked and surprised to see in such a remote village that 25 children of the age of 8 to 10, they came in line and they said, "Sir, I am also taking tobacco." And why I asked, "Why you are taking tobacco?" The answer was very, very nice. They said, "My papa is doing, my father is doing, so I am also doing." And then I asked about alcohol. "Oh, my dada, he is drinking, so I am also drinking." So do you see the condition of these children? And the simplest test which I do in every school, I ask my children to open their mouth and the four-finger entrance test. I think most of the people must be knowing. This is the simplest, easiest test, that you put your forefinger in the mouth. You can see, I think. And you'll surprise that most of the children, they are having three-finger entrance or the two-finger entrance, and then the root cause of this. Then I asked the children, they said, "Sir, मैं तंबाकू खाता हूँ." And a beautiful story I would like to share, that in Rajasthan, I think it is all over country, that the tobacco products should not be available within 100 meters of the institution. But what the children do, another children said to me that he complained to the teacher that this boy is taking tobacco. So the teacher asked from where he is getting. So what happened? This complaining child took him to the playground, and in the playground there was a pit, and on the pit there was a stone was lying, and when they removed the stone, then there was a lot of pudiyas, pudiyas packets of tobacco are there. So when in the interval, these children go there, eat the tobacco, and then again put this stone, and then they come to me. So there are I'm using certain herbal medication, which if you want I can share with all of you, because I have seen the wonderful results. Though I am basically allopath, but the results of this herbal preparation, which everybody can prepare in their house. Dr. Aruna, you can also prepare in your house. If you want, I can share it. Just simple. Take 2 lemon. Okay. Take out the juice out of it in a steel katori, right? And then put this adrak. I think everybody knows adrak.
Ginger.
Yeah,
Ginger.
Ginger. Small pieces of the ginger you put in this lemon, okay, till it dips and it is covered. Then you put dalchini. I didn't know what dalchini is called in English. I do not know.
Cinnamon, sir.
Cinnamon.
Cinnamon.
This is the powder, 1 teaspoon of powder of cinnamon. So one is the lemon juice, another is say the ginger, and third one is your cinnamon. Okay, and fourth is kala namak, rock salt. You all put and mix it together, and keep it in the 24 hours in the house, and after that you keep in the outside the sunlight. When it dries up, ask the children or whosoever want to get rid of the this addiction habits. I have seen the wonderful results of the preparation among my patients. They become de-addicted, or if in most of the cases in our country, we have to give medication in absentia without the knowledge of the patient, which is not possible in US. I had been to US 4 times. My son is an oncologist in Houston. But here we have to practice, give the medication without the knowledge of the patient, because patient doesn't want to leave. The children doesn't want to leave, but the parents want to that he should get rid of it. So this is the simplest, easiest, pardon? And cheapest.
Thank you so much for the information, doctor. Thank you so much. We are running short of time, and we want to know about this in detail. Can you send us a mail or some your contact details over chat, so that people will be getting in touch with you, and we will be following it up.
I have given my email address. Thank you very much.
Sir.
Give me
Thank you.
opportunity. Thank you very much.
Thank you so much.
Thank you, Doctor. In our tobacco monitor application, we have a referral services also. Definitely, we will get your contact and other details. We will link to the needy people, Doctor. Thank you for sharing your wonderful experiences, Doctor.
Thank you.
So thank you everyone for sharing your insights. It was a truly wonderful discussion. Next up, I would like to call upon Ms. Adeline, Project Officer of MAP, to deliver the vote of thanks.
Esteemed participants, as we come to the close of our online launch event, I would like to extend my heartfelt gratitude to each and every one of you for your invaluable participation and contribution. I would like to express our sincere appreciation to our distinguished speakers for sharing their expertise and inspiring insights. Your valuable contributions have provided us with invaluable knowledge and perspectives. I also would like to extend our gratitude to the organizers and partners. Without them, this event is not at all possible. Also, they work tirelessly to ensure smooth execution of this event, even within the short notice. Your enthusiasm is truly inspiring, and we are grateful for your continued support. Last but not least, I would like to extend our gratitude to each of the participants for their active participation and enthusiastic engagement throughout the event. As we move forward from this event, Ms. Jayanti instructed about the portal. It will be available for approximately 1 month period. In case of any doubts or clarifications regarding participation, feel free to call or mail MAC team. Once again, thank you all for being a part of this memorable event. We look forward for continued collaboration and success in the future. Have a great weekend. Thank you all.
Yeah, thank you very much. Thanks to Prajna for this wonderful coordination. And Dr. Rana always is the supporter, and all the partners. Definitely, we will reach to you, and then we work together. Really, we have to move to the masses. So this is one opportunity we have. So definitely, we will reach to the many big groups, and then we'll work together. Thank you very much. If you have any question or something like that, you can send mail, and then you can call us, and then definitely we'll be in that. Thank you, sir. Thank you very much.
Thank you everyone for joining.
Thank you.